told me I would sleep for a few days, that it would help with the sadness, that I would wake up feeling like myself again. I did not wake up for 26 days, and when I did not know who I was. It was 1959. I was 28 years old, and I had just given birth to my second child. The sadness came after, a heavy, gray thing that sat on my chest and would not move. My doctor said it was postpartum depression. He said there was a new treatment in Montreal at the Allen Memorial Institute. A famous doctor ran it, the president of 3 psychiatric associations. My husband drove me there on a Tuesday morning. I remember the building, large, white, institutional. I remember a nurse with cold hands taking my coat. I remember signing papers. I could not read because my eyes would not stop watering. They put me in a room on the 2nd floor. A small bed, white sheets, a speaker mounted on the wall near the ceiling. I asked the nurse what the speaker was for. She smiled and said, "Therapeutic audio." The first injection came that afternoon. Something thick and warm that traveled up my arm like liquid heat. The edges of the room went soft. The nurse's face became a white blur. I tried to say my daughter's name, but my tongue was already gone. Then the dark came, and it did not leave. I learned later what happened during those weeks. The doctor, Cameron, called it dipatony. He believed that if you could erase everything a person was, you could rebuild them from nothing, like wiping a slate clean. Except the slate was a human mind, and the eraser was electricity. They gave me electroshock therapy, not the standard dose, 30 to 40 times the normal power, enough voltage to cause brain damage. They strapped me down, placed the electrodes on my temples, and sent current through my skull while I was still half conscious from the drugs. I have no memory of the shocks themselves, only fragments, a flash of white, the smell of something burning, and the understanding somewhere deep in the animal part of my brain that the burning was me. The speaker on the wall never stopped. They called it psychic driving, a recorded voice looping the same sentences over and over for hours. Days, weeks. You are not well. You need help. You must change. You are not well. You need help. You must change. The same words, hundreds of times a day, drilling into whatever was left of me, while the drugs held me under, and the electricity scrambled what remained. One patient in that building, I learned this years later, was kept in sensory isolation for 35 days. A dark box, no sound, no light. Then they pulled her out and subjected her to 101 days of psychic driving. The medical report noted, no favorable results were obtained. No favorable results, as if the destruction of a person were a clinical observation. When I finally came back, if you can call it coming back, I could not control my bladder. I could not feed myself. A woman and a man came to visit me, and the nurse told me they were my parents. I looked at their faces and felt nothing. Strangers. I thought the nurses were my parents, the people who had tortured me for weeks. I believed they were the ones who loved me. My husband came. He brought photographs of our children. I held the pictures and turned them over in my hands like foreign objects. I knew, intellectually, that these were babies, but I did not know they were mine. Dr. Cameron commuted weekly from Lake Placid, New York. He drove across the border every Monday morning, spent the week destroying minds, and went home to his family on Friday evenings. The Central Intelligence Agency paid him $69,000 for his work. His techniques, the sleep rooms, the psychic driving, the massive electroshock became the foundation for CIA interrogation methods used around the world for decades. The man who broke my mind, torturers, how to break others. I am 71 years old now. I remember my children again, most of the time. There are gaps, whole years that simply are not there, like pages torn from a book. Sometimes I hear a voice in my head, not my own, repeating the same sentence over and over, and I know it is not a memory. It is a scar. You are not well. You need help. You must change. I never changed. I was just erased. The last thing I remember was the count. The anaesthetist asked me to count backwards from 10. I got to 7. Then I was somewhere else. Not asleep, not unconscious, awake. Fully, completely, terrifyingly awake. I could hear everything. The beep of the heart monitor, the rustle of surgical gowns, someone's shoes squeaking on the tile floor. A voice, calm, professional, saying, "Scalpel." I tried to open my eyes. Nothing happened. I tried to open my eyes. Nothing happened. I tried to move my fingers. Nothing. I tried to scream. My throat was a tube. My lungs were a machine. Every muscle in my body was locked. Paralyzed by the neuromuscular blocking drug they had administered alongside the anesthetic. The drug that keeps patients still during surgery. The drug that was keeping me still while I felt everything. The first cut was a line of fire across my abdomen. Not distant, precise. I could feel the exact path of the blade, the parting of skin, the slow separation of tissue beneath. My brain screamed at every nerve ending to move, to jerk, to do anything. But the signals died somewhere between my will and my flesh. I was a passenger in my own body, trapped behind my eyes, listening to surgeons discuss my internal organs, the way mechanics discuss an engine. Retractor. A cold metal instrument pulled my abdominal wall apart. I felt the stretch, the pressure, the wrongness of being open. One of the nurses was humming, a melody I almost recognized, something from a car advert. She hummed it while my insides were exposed to the fluorescent lights, while I lay there experiencing every second of my own disassembly, unable to produce even a single tear to signal that I was in there. I was in there, please. I was in there, please. There is a technique called the isolated forearm technique. A tourniquet is placed on one arm before the paralyzing drug is given, cutting off blood flow to that limb. The arm remains unparalyzed. If the patient is conscious, they can move their fingers, they can signal, they can say, with one trembling hand, "I am awake. I can feel everything. Stop." No one used the isolated forearm technique on me. I do not know how long the surgery lasted. Time became a flat, unbearable thing. Each second had weight, each second had texture. The pain came in waves, sharp when they cut, dull when they pulled, burning when they cauterized. I felt the smoke from the cautery tool rise inside me. I smelled it through the ventilator, the smell of my own cooked flesh. At some point, I cannot say when, the pain became something else, not less, more, a totality, as if my entire existence had been reduced to a single frequency, and that frequency was agony. I stopped being a person. I became a nervous system. Nothing but wires and fire. Then slowly, like sunrise through fog, sensation returned to my fingers. First the left hand, a twitch, then the right, then my eyelids. I opened them, and the operating theater was bright and ordinary, and the nurse was adjusting my IV drip, and she looked at my face and saw my eyes were open, and she smiled. "Welcome back," she said. I could not speak. The tube was still in my throat, but I was crying, and she thought it was the anesthetic wearing off. She dabbed my eyes with gauze and told me the surgery had gone perfectly. Only 35% of patients who experience anesthesia awareness can report it immediately after surgery. The rest of us carry it silently. Some do not remember for weeks. Then the memories surface, not as recall, but as nightmares, as panic attacks in grocery stores, as the inability to sleep without checking, again and again, that you can still move your hands. A Swedish study followed 9 patients who experienced what I experienced. 2 years later, 4 of them were still severely disabled by unable to work, unable to enter a hospital, unable to let anyone touch them without flinching. It happens in roughly 1 in every 500 surgeries. You can be lying on that table right now in any hospital in the world. And there is a statistical chance that you will hear the count to 7. And then hear the word scalpel. Redheads require more anesthesia, a genetic variation in the melanocortin, 1 receptor. If you have red hair, the odds are slightly higher that the drugs will not take you deep enough, that somewhere between the incision and the suture, you will be waiting, silent, still, screaming inside a body that will not listen. I still count sometimes before I fall asleep. 10, 9, 8, 7. And I pray I never stop at 7 again. I was 13 years old the first time he cut me open. I did not know his name then. I only knew he was the doctor, and that I had no say in what happened next. My name is Anarcha, at least that is the name they gave me. I was born enslaved on a plantation near Montgomery, Alabama. The year was 1845. I was a child who had recently given birth, a child whose body had torn during labor and would not heal. A fistula, a wound between the bladder and the birth canal that would not close. Urine leaked constantly. The skin around my thighs was raw and burning. The smell followed me everywhere. My owner brought me to Dr. James, Marion Sims. He had built a small hospital in his backyard, 8 beds, a table, and a set of instruments he had designed himself. He was experimenting, trying to find a surgical technique that could repair the fistula. He needed bodies to practice on, and we were there, enslaved, black, unable to refuse. The first operation was in June. They laid me on the table. Other enslaved women held me down. He had recruited them as assistants. There was no anesthetic. Ether had been demonstrated in Boston the previous year, but Sims did not use it on us. Not once. Not in 4 years. He cut, and I screamed, and he cut again. The pain was not like anything I had words for. It was a bright, white thing that filled the room. I could feel the metal inside me, the speculum pulling tissue apart, the needle threading through flesh, the tug of suture as he pulled it tight. I could feel every movement as if my nerves had been pulled outside my body and stretched across the table. The other women held my arms, held my legs. One of them pressed her hand over my mouth when my screaming became too much. I could feel her trembling. She was crying. We all were. The first operation failed. The repair did not hold. The fistula remained. Sims examined me the next day, made notes in his journal, and told his assistant to schedule another operation. There would be 29 more. He operated on the other women too, Betsy, Lucy, others whose names the history books did not bother to record. During one of Lucy's surgeries, Sims left a sponge inside her bladder. He sewed her closed with the sponge still in there. She developed a fever. Her abdomen swelled. She nearly died from sepsis before he reopened the wound and found it. 8 days later, he wrote about it in his notes. A clinical curiosity, a learning experience. The justification was simple. The same justification that underpinned everything done to us in those years. Black people, they said, do not feel pain the way white people do. Our nerves were supposedly coarser, our bodies tougher, our suffering less refined. A lie so complete, it became medicine. A lie so convenient, it became science. I learned to dread the sound of his footsteps, the click of the gate, the creak of the hospital door, Each operation was the same. The table, the instruments, the hands holding me down. And each time, when it was over, he would examine the repair and shake his head. Not yet. We will try again. I stopped counting after 20. The numbers blurred together. Each surgery was a separate country of pain, and I had traveled through so many that I could no longer tell them apart. I knew only that I was tired, that my body had been opened and closed so many times it barely felt like mine anymore. That I was a wound that someone kept refusing to let heal. In 1849, after 30 operations over 4 years, Sims declared success. The fistula had closed. He published his findings. He described his technique. He did not describe the screaming. He did not describe the women who held me down. He did not describe the sponge inside Lucy, his bladder, or the infections, or the nights I spent shaking with fever on a cot in his backyard, unable to sleep because the pain was louder than exhaustion. He went on to become the father of modern gynecology. When he finally operated on white women, he used anesthesia. He used anesthesia on them. He never used it on us. His statue stood in Central Park, New York City, for 124 years. Bronze, tall, looking westward with the expression of a man who believed he had done something noble. It was not removed until 2018. In 2021, a monument was erected in Montgomery, Alabama. It is called the Mothers of Gynecology, 4 bronze figures of black women standing together, looking forward. Anarcha, Betsy, Lucy, and the unnamed one. I do not know what happened to me after the 30th operation. The records end. The doctor moved on to other experiments, other patients, other cities. I returned to the plantation. I was still enslaved. I was still black. I was still a woman in a country that considered me property. But I had survived 30 times being cut open, 30 times the bright white pain, 30 times the table and the instruments and the hands. They built a statue of him. They built a monument of us. I wonder which one will last longer. I wonder if anyone will ever know my real name.